Hi, I'm coming to you from my living room tonight. Um, just wanted to do another little video since I'm kind of on a roll. Have my glasses on tonight. I do wear glasses. I didn't today when I made my first video because I have the transitions glasses, and so I had just came out of the sun, and yeah, I just didn't want the whole darkness effect. I also like myself a little better without glasses, but I've worn them for years, so now they're just a part of me. But anyway, I wanted to do a quicker video this evening about my liver biopsy. I know many people here who are facing liver diagnoses or possible autoimmune issues of the liver. One of the standard tests, unless your blood work just totally shows something definitive, one of the tests will be a liver biopsy. And it sounds scary. And it is scary. I mean, anytime you put a needle into a major organ, an organ you can't live without, that is very a traumatic thing to think about. And it was for me. And again, my late husband, the last procedure he had was a liver biopsy. And no, I don't believe that's what killed him. Definitely the cancer is what took him from us. But I think the liver biopsy in his case might have accelerated things. I don't have proof, but maybe accelerated it by a few days. I've got a little video partner who wants to come up here now. That's Benny, my sweet 1-year-old orange cat. He's a great guy. Love him. He's my emotional support animal. But anyway, again, what happened with Ron was inevitable. It was, as sad as it was his time. But the thought of going through a liver biopsy for me was very scary. In fact, I put it off for over a year. And I needed that time. I did. I needed that time to come to terms with what was going on with me, to do the research, to just get ready for myself. And, there's times when you should jump into medical procedures, and there's times when you don't need to jump into a medical procedure. I didn't feel that I needed to jump into that. Again, I went some alternative routes first. And did some other things to try to kind of mitigate the need for that. But, things progressed, and I did finally come to terms with the fact that I needed to go through with the liver biopsy. He's making biscuits now. So, I just wanted to I want to come here, especially for people who are facing liver biopsy for whatever reason. There's lots of liver diseases out there. There's lots of reasons a doctor might want to do a liver biopsy, from cancer all the way to, I don't know, to what I have, which is pretty mild, it seems. Again, I don't see the doctor until next Tuesday. So, but per the path report, it's a mild autoimmune hepatitis with maybe a drug induced autoimmune response. And what I didn't say in my first video that I'm going to say here is that they also tested me for all the viral components, the hepatitis A, B, and C, parasites, everything that could possibly be affecting my liver, virally or parasitically, I ruled out for. So I'm not a contagious person. Not that probably many people who will watch this will ever be in my presence, but I do not have any of those bugs. Thank the Lord. So with that disclaimer over, there's many reasons people have liver biopsies. You will go to the radiology department. I went here. I live in Charlotte. I went to Carolinas Medical Center, went to their main campus, went to their interventional radiology department. And these procedures require either a CT scan or an ultrasound guidance. I had the ultrasound guidance. If maybe they think you have a liver mass or cancer, they might go the CT route because they need to be a lot more precise. Me, they just wanted a good general sample of my liver itself and the portal ducts. So that was easy enough to find on ultrasound. So you'll go to the interventional radiology department, or you'll go to a facility that just does this kind of thing. They will take you in. In my case, I'm just going to tell you what they did in my case. I've heard of people that didn't have any kind of pain medication or sedation offered. My facility, I filled out a little checklist. You know, one of the questions was, are you having anxiety from mild to severe? I put mild because by the time I got to the procedure, I was ready to do it. I was ready to get it over with, but there was a little bit of anxiety. That's just normal. So I checked mild, and, you know, they never asked me about it. They just come in and told me, hey, we're going to give you a Xanax. We're going to put a line in, and when you get close to time for the procedure, we're going to give you some Dilaudid, which is a pain medication. All of that will settle you down and reduce any pain you might feel during the procedure. I had to go in about 2 hours ahead of the procedure. And they prepped me. They put an IV line in, which did take a little while on me. I have very small veins. Had to stick me about 3 times. But again, I'm not a sissy about those kind of things. Not that anybody who's scared of needles are sissies. Sorry, wrong word. But I did. You know, I'm not scared of needles, and so that didn't bother me. Was happy to have it. So they prepped me. They had to do some lab work. They have to make sure your platelets are okay, or in the range they should be. So again, there's a bleed risk. That's the major risk with this procedure, is bleeding. So they have to make sure your platelets are high enough so they know you're going to clot. They ask you some medical questions. You know, of course, the medications you're on. Did you eat? You have to be fasted. You have to be fasted. I was able to drink sips of water that morning. That was fine, because they were going to put me completely out. So around 9 o'clock was when my procedure was supposed to be. Of course, ended up being a little later. And then before I even went back, what do you call them? A physician assistant came in and talked to me. And then the radiologist himself came in and talked to me. Both were very nice. The radiologist was more businesslike. He was, you know, very businesslike. So they took me back about 9 o'clock into a special room. They had an ultrasound. They prepped me. They did different things to get me ready. And by this time, they had given me the Dilaudid in my IV, so I was feeling fine. I was fine. I was very much awake, though a little bit drowsy, but just very relaxed, which is the way I wanted it to be. So the radiologist, he kind of didn't come in, and to the point that the technician called him twice, like, "Are you coming?" And he finally did. He was still very businesslike, but he was very kind, and he told me everything he was going to do, and everything he was doing, he would tell me. He's like, "If you don't want to know everything I'm doing, just tell me to be quiet." I said, "No, I like to know what's happening." So he prepped and draped me. He brought out a small needle first and said, "I'm going to numb your skin area around the area we're going to do the biopsy." And, well, yeah, I think he did that first. Either that. At some point, he did an ultrasound and just looked at my liver. And then I think he prepped and draped me, because you get all that goo on you. And then he prepped and draped me. So then he marked the area where he was going to do the biopsy. And then, you know, he said, I'm going to numb your skin first. So he brought out a little needle. Did that. A little sting. Feels like a little bee sting. It's not even that bad. Then he said, I'm going to numb you now deeper into the area where we'll be going into your liver. Well, then he breaks out a needle that was probably a half a foot long. Again, like I said in my earlier video, I am not a needle phobic person, but that gave me pause. And I did not watch it. I turned my head because I didn't want to see it. And I felt it a little bit, but again, I felt more pressure than anything, just a little bit of ache. And then that was done. So he waited for about 2 minutes, and then he said, okay, I'm going to start the biopsy. It's going to be very quick. He said it's going to sound like a staple gun. He said, I'm going to take 2 cores, 2 places. So you're going to have 2 little, it's going to look like a little spider bite when it's all said and done. 2 little places fairly close together. It was right around my right bra line. And his upper right lobe of the liver is where he did it. So he did it, and it was just like, click. He was like, we're done. And so they unprepped me, got me back, and, got me decent again, and then rolled me out. And then the next 3 hours, I was treated to lunch. I could watch TV. I had Wi-Fi. I just had to stay mostly still. They said to wait as long as possible before I would get up and go to the bathroom. But if I absolutely needed to not go unattended, because they were watching for bleeding. And basically, they came in every 30 minutes and looked at the little Band-Aid. They put a Band-Aid about that big on the area and just made sure there wasn't blood. And I was on, every once in a while, the blood pressure cuff would inflate. I had one of those things on my finger that, gives you your pulse ox and your pulse. So it's basically just sit there and waited and ate some lunch since I was fasted. That was good. It was a little turkey sandwich and some chips and a ginger ale. So waited, and then about 3 hours later, they said, you're doing fine. So if you're ready to get up and go to the bathroom, you feel steady. Drugs were wearing off by then. Went to the bathroom. They said, let us watch you about 15 minutes after you come back from the bathroom. Looked at my bandage again and said, you're good to go. Call your ride. And so my beautiful, wonderful stepson, who I call my son-in-love, was with me the whole entire time. Now, he didn't stay in the room with me the whole entire time because it was a very small little cubicle area I was in. But he was there the whole time and took me home. We went to Einstein's Bagels, got a bagel for lunch, and then he took it home. So that was it. And again, once I got home, my orders were to rest for the next 24 hours, which I pretty much did. And, any heavy lifting outside, I had my neighbor come and do my garbage can because it was getting ready to be garbage day. And I just took it easy. And again, I really didn't feel anything that evening. The next morning, there was just kind of a twinge in my right side, like maybe I'd pulled a muscle. The bandage area was just a little sore. That was it. Nothing major. And pretty much for the next 24 hours, I just laid around. And by the second day, I would say by Friday, you wouldn't have even known I'd had anything done. So, again, that's my experience. Your mileage may vary, but to me, the liver biopsy was not bad at all. I had it more worked up in my brain to be worse than it actually was, which is my MO. So, anyway, hope this has encouraged you. Don't put it off just because you're scared of pain or what you're going to find out. That was a little scary for me. I mean, anytime you're getting a biopsy, you automatically think cancer, even if you know in your mind that's not what they're looking for. Sometimes they are, but you never think, I was thinking, what if just some random cancer cells show up, you know, how will I deal with it? Well, you just deal with it. You deal with whatever comes your way. But again, just all that to say, to me, liver biopsy was a walk in the park. Other than the time involved, it was a walk in the park. Well, thank you, and I hope this helps you. Bye.